Well, if you are one of the 27 million Americans who have knee pain, you might be taking over-the-counter or prescription pain meds, going through physical therapy, or taking aspirin or non-steroidal anti-inflammatory drugs, NSAIDs. And with all the side effects, and really depending on the severity of the pain, your knee might still be hurting today. So here to tell us more about knee pain and what it's like to live with it is Dr. Stan Dysart, orthopedic surgeon at Pinnacle Orthopedics, and an osteoarthritis sufferer, Christina O'Shea. Thank you both for being here with us this morning.
Thank you, Danielle. Glad to be here.
Doctor, let's start with you. Tell us what osteoarthritis, or OA, of the knee is.
OA is actually a disease process. The knee actually deteriorates. The cartilage cap on the end of the bones rubs away, and the thick fluid in the knee that lubricates becomes thinner and loses its effectiveness.
What are some of the common symptoms, I guess, that people should look out for?
When patients see me, they say their joints hurt, their joints swell, they grind, they just are unhappy with how they feel.
What can cause OA of the knee?
There are many causes. Now, we know that when people get older, they're more likely to get OA. Heavy patients or obese patients, that's strongly connected to OA. There are strong genetic factors. If your mother or father had OA, you're likely to get OA. Trauma can cause OA. And believe it or not, more women have OA than men.
How does OA of the knee then progress?
Well, the cartilage cushion thins, cracks, and wears away, and the bone's exposed. When the bone's exposed, you get spurs and cysts.
Well, Christina, I know, and Doctor, we know that now that it is manageable and treatable, but Christina,
yes,
I know that you are an osteoarthritis sufferer. Tell me your story. How did you know?
Well, I fell, had a bad fall on my knee, didn't think anything of it. About 6 months later, the knee started to swell, pain, heat. Couldn't do the things that I normally did.
That's true.
Is that a pretty common indicator?
Yeah, many patients, they can't do what they want to do. Their active lifestyle becomes a non-active lifestyle. That's a problem. They need to be active, and they can't.
So you find that your activity level decreased significantly?
Absolutely. Didn't do my 4 miles anymore, couldn't golf anymore, and the pain is intense.
And you went to the doctor?
Yes.
Went to my orthopedic, diagnosed me after tests, osteoarthritis, learned to live with the pain.
Learn to live with the pain. So it's still painful for you today?
Absolutely. Night times, I can't kneel on it, try with aspirin and other relievers, but nothing seems to work.
Doctor, talk a little bit about that.
You don't need to live with the pain. There are things we can do which are very effective that don't involve surgery. And injectables is an exciting new area for the treatment of osteoarthritis.
Well, those injectables might be an option for you. Is that something that you thought about, Christina?
I'm going to get information on it, and definitely I will think about it.
Because we got to get you out there walking those 4 miles again.
I'd love it. I'd love it.
Doctor, where can we go to find out more information?
Well, the Arthritis Foundation has a wonderful website, arthritis.org, and euflexxa.com is a great website about injectables and OA.
Sounds good. Christina, thank you so much for sharing your story with us. We appreciate you. And Doctor, thank you as well for your wonderful insight.
Okay, thank you.
If you saw a story here today that you want to see more of, just go to www.thebalancingAct.com.